On behalf of the American Academy of Neurology and in collaboration with Neurology Today, it gives me great pleasure to introduce an old friend, colleague, Bob Roth. Bob is one of the most experienced meditation teachers in the world. For the past 45 years, Bob has taught Transcendental meditation to many thousands of people and probably tens of thousands and honestly millions of people through all the different programs that he's facilitated or been involved with, from veterans suffering from PTSD, inner city youth, and I'd love to hear about the work you've done with providing free transcendental meditation classes and instruction literally millions of young people, as well as, of course, CEOs, Hollywood celebrities. I won't drop any names, but he floats around with some cool cats. I'll put it that way. I most recently saw Bob at a couple of Yankee games, a couple of playoff games. That was lots of fun. Bob was in the fancy seats. I was like in the nosebleed.
No. I came and sat with you.
Okay. I had a decent view, but you had a pretty good thing going too.
That's where I'm going to cut you off. That's where you were as a kid. Didn't you sit there or something like that?
That's the same section. You got it. You got it. That was my one most exciting experience as a child, sitting in that place in Yankee Stadium. So Bob, you're currently the CEO of the David Lynch Foundation. You and I both don't like getting our attributes read, so let's just put that aside. But if you want to learn more, just Google his name, listen to his podcast, a Sirius XM show, and books and all that kind of stuff. But Bob, thanks so much for joining today. This is super cool.
Really happy to be here with Richard,
cool.
And have this discussion.
Great. So on behalf of the American Academy of Neurology, thank you. We have over 36,000 members, neurologists from not just all around the United States, but also around the world, nurse practitioners, neuroscientists, lots of staff, lots of people, med students, resident trainees. And I'd really love to start off by talking about, the contributions and potential importance of meditation in the age of COVID-19, specifically for healthcare workers. We're both based in New York City. I live a block away from Weill Cornell and New York Presbyterian. During the heart of the madness, it's I think I probably have some form of PTSD, because if that's the correct term, and I think about it and I start getting a little anxious and a little sweaty, and I just remember every 3 to 4 minutes an ambulance would come by. This was in March and April, and my whole family got COVID. We were not as sick as some people. I'm still recovering. I'm still not 100%. But COVID-19 has been, I would say, traumatic from both personal and family perspectives, but also for healthcare workers. Many of us are not able to make money anymore and kind of pay our bills in the way we used to. I'm seeing about 30% or so of our clinical practice revenues down by 70%. We got people on the front lines, doctors with boots on the ground, risking their lives literally on the front lines, helping people in emergency rooms and wherever else. And then 6 weeks later, they get furloughed. Literally, and job cuts. Despite all the craziness, we volunteered, we jumped in, and then I know at least 2 friends that have been furloughed. Unbelievable, So Bob, first of all, let's talk about the importance of stress reduction meditation for healthcare workers, and what are your thoughts about that?
Well, it's a very timely topic, and I head the David Lynch Foundation, and actually we were talking about this before, where we've launched an initiative called Heal the Healers Now, which is to bring stress-reducing evidence-based meditation, particularly transcendental meditation, for free to the doctors, nurses, and healthcare providers on the front lines of this terrible battle. The thing is, Richard, there's sort of never been a greater need for something like meditation because of just what you're talking about for healthcare workers. There's never been more opportunities. There's Headspace, and then there's Muse, and then there's mindfulness meditation and transcendental meditation, and the skeptics among us could say the whole thing is bogus. But there's never been sort of more opportunities, and there's never been more confusion. What the heck is meditation? What are they all the same? Do they do the same thing? So if there's time, I could do a little mini master class, because I think it's important to know that there's a lot of solid research now on meditation, and so you can't just sort of say, well, I'm a skeptic, and just dismiss it, because that's silly. The behavioral health problems that you're talking about, anxiety, depression, symptoms of PTS, insomnia, substance use, those are very real things, and there's no magic pill we know that we can take to ameliorate those symptoms. So what is meditation? And I like to use an example or an analogy. You're on a little boat, you're not quarantined, so you're in a little boat and you're in the middle of the ocean, and all of a sudden you get these giant 30, 40, 50-foot high waves, and you could think the whole ocean is in upheaval. But if you did a cross-section, you'd realize it's not the whole ocean, because the ocean is miles and miles deep, and while the surface of the ocean may be turbulent, the depth of the ocean is pretty darn silent. And this is the analogy we use for meditation in the mind. Surface of our mind is the active thinking mind. It's like the tsunami waves. And I got to do this, and I got to do that, and I got to call him, and I got to call her, and I got to make a list, and I got to find the list, and I got to slow down, and I got to get going, and all the gotta's. And so it's a natural human desire to think, I'd love to have some inner calm, I'd love to have some inner clarity, some inner focus, and the operative word there is inner, and here's the realm of meditation. So meditation is supposed to bring calm and equanimity to the mind. And for the longest time, Richard, they thought all meditations were pretty much the same. It didn't matter what you did as long as you took some time out. Well, now brain research, and we've talked about this before, has identified 3 basic types of meditation. And I'll use the analogy of the ocean to clarify. The first is called focused attention. Now, focused attention is your classic meditation, which most people say, I can't meditate, because you're supposed to clear your mind of thoughts. And stop your mind from thinking, to use the analogy. If you want to have a calm ocean, what's the disruptor of a calm ocean? Waves, so stop the waves, and then you'd have a calm ocean. If you want to have a calm mind, what's the disruptor of a calm mind? Thoughts, so stop thoughts. Well, that's done by concentrating or clearing your mind of thoughts. When we do that, it creates gamma brain waves. Second approach is called open monitoring. And many of you are probably familiar with mindfulness techniques. And open monitoring teaches us that thoughts aren't necessarily the disruptor of calm, but the content of thoughts can be the disruptor of calm. So if I have a thought about a guy named Joe and I don't know anybody named Joe, no disruption. But if I have a thought about a guy named Joe and 5 years ago Joe done me wrong. So what mindfulness or open monitoring does is it teaches us to be dispassionately observe our thoughts. It's a meditation technique where you just watch your thoughts, and you're not 5 years ago or 10 years ago, you're right now, in the moment, and there's equanimity. When we do that, it creates theta brainwaves, largely. Also alpha 2, but largely theta brainwaves. These 2 approaches, and I know this is a lot of detail, I hope it's okay, but these 2 approaches are called cognitive approaches to meditation, pertaining to your thoughts, your moods, your feelings, your behavior, waves. The third is called self-transcending, and that's what I've been practicing and teaching for 50 years. And self-transcending recognizes that there's a vertical dimension to the mind, that we feel things deeply, or we have an intuition, somebody comes to you and they pitch an idea to you and it makes sense up here, but your quiet mind goes, I don't think so, Jack. In self-transcending, we hypothesize that even deeper than that, there's a level where the mind is already settled and calm and wide awake. That's a hypothesis. You don't have to believe in it, but we've lost access to it. And in self-transcending, transcendental meditation, it's the simplest, the easiest technique that allows your active thinking mind to just settle down and access that calm that lies within. And when that happens, it creates something called alpha 1. And alpha 1, what you see with that during TM is a coherent spreading across the whole brain. There's a calming of the amygdala. There's a strengthening of the connections for the prefrontal cortex. There's an awakening of the default mode network, which is also called the imagination network or the genius lounge. There's a whole galaxy of changes that take place in the brain and the body. That was a big blurb of information, but now you have something that we can work from that.
Yeah, and honestly, as a neurologist, I'm a brain doctor, right? I don't know that I have ever, first of all, been taught about that in any structured format in any sense of in any stage of my training. In medical school, I guess we kind of got like an overview about it, and then in neurology residency, we were running around, treating strokes and like managing seizures and just always moving and going. Not let alone like doing stress reduction techniques and meditation ourselves, but not really learning about this. And then once you get into clinical practice, most specialties, you get stuck in your specialty and stuck in a rut. And just the breaking it down into those three subsections and really emphasizing the neuroscience behind it all and the, electroencephalogram changes. Neurologists understand what EEG brain waves are, understanding that these practices actually have an effect on the brain. And then even further, it has effect on the body, with cortisol levels and other elements.
Well, there's a 30 to 40% reduction in cortisol during the 20 minutes of TM, and that's published in peer-reviewed journals. Yeah. There's an increase in serotonin. The National Institutes of Health have given $26 million to study the effects of TM on high blood pressure, hypertension, atherosclerosis, a risk of stroke. The American Heart Association came out and said transcendental meditation specifically was highly effective for reducing risk factors for high blood pressure. So there's a whole constellation of changes. And, it's an interesting thing. You were talking about medical school. Well, let's just talk very frankly. There's a big upsurge of suicides now among medical students. And it's, again, I opened by saying we have to move past the idea, meditation, that's just bogus. I probably should have started this conversation by saying I've been teaching TM for almost 50 years. And if you were to think of what a meditation teacher would be like, I ain't that guy. Right. I mean, I'm a skeptic. I love data. I love facts. I love big ideas. But I like it to be anchored in things, in something substantive. I'm not into new age or sort of woo-woo. But the amazing thing is, these problems we're facing, particularly in the healthcare profession, need a new intervention. And there's a lot of bunk in the name of meditation, but there's some real gems out there too.
Yeah, and that's really, really important. At the American Academy of Neurology annual meetings, for the last few years, we've had an experiential learning center and more emphasis on wellness. And for the first time, really, in the last few years, they've actually made these impromptu courses, 5, 10, 15-minute lectures. As you're walking from one lecture to another, and you're running and you're presenting your research and sweating, you have the poster and you're managing all these meetings. The American Academy of Neurology is actually trying to spread these messages and to educate physicians, which is great. But kind of a masterclass of what you just reviewed is key. I have so many questions for you. Just briefly, if a neurologist or an AN member is watching and wants to learn more about transcendental meditation, or meditation in general, is there a specific resource you recommend, or specific something, or is there just a lot of good information?
I would say go to Heal the Healers, plural, healthealersnow.org, and that's the initiative we have for healthcare providers. You can also go to tm.org. It's a nonprofit organization. And I do want to say one more thing, that this issue now, what you were talking about at the beginning of experiencing PTS, they like to call it PTS, not D, post-traumatic stress, that more and more healthcare providers are experiencing that. I'm here, and we're working on the front lines in New York City with Elmhurst, the public hospitals, Elmhurst and Bellevue and Brooklyn, as well as Weill Cornell and Mount Sinai and elsewhere, and actually all around the country. And we're launching a big study with Duke University on TM for physician burnout. But where really the forefront is the work that we're doing with TM with veterans. Several years ago, the Department of Defense gave us a $2.4 million grant to study TM in comparison to prolonged exposure as an approach to addressing the problem of PTS for post-9/11 veterans. And the study was published in Lancet Psychiatry, and it found that transcendental meditation was as good, if not better, than prolonged exposure for addressing serious issues of PTS. And now a $7 million study is about to begin in 8 VA hospitals, a multi-site randomized controlled trial. And the outcomes from that study will be used to leverage support so that any of the 1 million vets who have PTSD in the country could learn to meditate, covered by the VA, could learn to meditate. So it's a new time, and it's driven by data.
That's great. I wanted to, and just building on the driven by data, I think in any subspecialty of neurology, whether you type into PubMed or Google Alzheimer's disease and meditation, or epilepsy and meditation, or Parkinson's disease and meditation, I feel like there's at least 1 to 5 to 10, who knows how many studies for each. Alzheimer's, I would say there's a handful. And meditation specifically addresses components of many neurological diseases. For example, Alzheimer's disease, I wouldn't say that the body of evidence for Alzheimer's is, dozens and dozens of papers, but there are certain papers, Journal of Alzheimer's Disease publication in 2018. I can name several, but attacking the components, just like you said, with cardiovascular disease, if you want to fast forward memory decline in Alzheimer's, don't control your blood pressure, don't control your cholesterol, let your blood sugars go sky high, and don't control your diabetes.
And don't worry about how you sleep or not. Doesn't matter if you don't get any sleep.
Exactly. That deep sleep and slow wave sleep is really when, the garbage gets taken out, the amyloid gets really deposited. Exercise maybe loosens it up, colloquially speaking. There's so many pathways. You mentioned, true evidence about cortisol. There's data, there's a study in Canada that actually showed lower overall healthcare costs by people that practice TM. So the data is overwhelming, but I guess not a lot of neurologists just haven't seen it.
Well, I think there's also some new idea. It takes time to sort of percolate through, and we also have my generation had a huge cynicism towards the word meditation, because it was just associated with such nonsense and philosophy and religion and sect and chanting and all of that stuff. I think it's just taken time, and in time, for example, when TM first came out 50 years ago, you didn't want to say the word meditation in public, and now, as I said earlier, we're working with military bases. I'm here in New York working with a lot of large banks and multinational corporations, and we're working with inner city school kids. David Lynch Foundation has provided scholarships for 1 million kids in the U.S. and around the world to meditate for free. And we just did one study in Chicago with 2,000 kids, teenagers, attending the toughest schools in South Side of Chicago. And they wanted to see if TM could promote, reduce impulsivity, that there would be a little bit more of a gap between action and reaction. And they were looking at reductions in arrests for violent crime. And ordinarily, if you have a reduction of 20 or 30% in arrests when you do an intervention, they're happy. 70% reduction in arrests for violent crime with the kids who were meditating. And that was a randomized controlled trial done by the University of Chicago Crime Lab in partnership with the Chicago Public Schools.
Wow. You mentioned the amygdala and frontal cortex. There has to be a neurological basis.
Oh, yeah, absolutely.
Whether it's functional MRI, whoever.
All that.
Wow.
It's very exciting, and I really appreciate and congratulate you, and even though I am a San Francisco Giant fan, and I did go to the Yankee game with you, that you're bringing this up as a topic, because if we don't hear this stuff ordinarily, then we don't know this stuff.
Yeah. And speaking of San Francisco, you're a UCal Berkeley guy, and you were there in like the mid to late 60s or something, and the word meditation was taboo even at UCal Berkeley in the 60s. I don't even know what to say about that.
Well, the thing is I grew up, I was this, very politically minded family, and I worked for Bobby Kennedy when I was in high school, and I wanted to change the world, and I went to Berkeley with that idea of going to law school, and it took me about a month to realize that politics may not be the thing that's going to heal the soul of the nation. And then I got into educational curriculum, and I learned to meditate, and I had a thought after I learned. I said, this is a tool I'd like to teach those kids, and that was 51 years ago. So now we have this foundation, and we're doing it. We're addressing the thing about it, Richard, is there's a pandemic of trauma and toxic stress that nobody is immune from, nobody, and particularly our kids. Number 2 cause of death among teenagers in America today is suicide. So we can't, and there's no vaccine that we can take. And so we have to look at interventions outside the sort of narrow, restrictions. And we have to look at the data. And whatever the name is, whatever the vocabulary is, meditation, look at the data. It's very revealing.
Yeah. So, again, so much I could talk to you about, but So there were the three types of meditation you talked about with, and the influence on brain waves and other aspects. But I wanted to get your opinion about the three types of neurologists maybe that are watching. And I guess what I would say, I'm generalizing, and I hate to, I'm like such a non-generalizer. So I apologize to the audience for trying to generalize and that I'm talking to. So not trying to generalize, but just for conversation's sake. I believe that there are physicians out there and healthcare practitioners out there that recommend meditation to their patients and adopt meditation in their own lives. I think that's one category. I think there's also physicians out there that recommend meditation, maybe not as passionately because maybe they don't know as much, but they've read some articles or they just feel like the person has a lot of stress. It can help their chronic neurological condition or their acute neurological condition. They recommend it, but they don't practice it themselves. And then there's the skeptics. There's the people that say, you use the term, the woo-woo, like meditation's woo-woo. Come on, there's no biological basis of, saying something or focusing the mind and, the waves and, brain waves. Oh, what kind of study? What was that? What was that study in? What journal? How do you, for the people that are watching, how do you maybe address each group? When we first had our first conversation, I think it was in either LA or in New York at it was a Maria Shriver event, and we were on a panel. And I said, well, I recommend it to my patients, but I can't shut my brain off. I'm not really good at that stuff. It doesn't work. And you were so like, I don't know, just like whatever the word, you were so manicured in what you said, and I'm just like, that makes a lot of sense. I had never seen it that way before. For those neurologists and healthcare providers that are watching, how do you recommend approaching these three different buckets?
I say to the person who's skeptical, it's healthy to be skeptical. It's healthy to ask those kinds of questions. Where was it published? It published in peer-reviewed journals. It's correct. I mean. So that's number one. And then number two, the great thing about, at least for me, about TM is you don't have to believe in nothing. You can be 100% skeptical. You could think, as I was when I learned, you could think the whole thing is bunk, and it still works just as well. It's like if you don't believe in gravity, whatever. If you don't believe in this meditation, it happens. And that's why we're in military bases, and that's why we're in all these hospitals and research is going on, because it respects a person's skepticism, and it doesn't say you have to forego your rational intellect. And as far as the people who don't take the time to meditate, I think there's two different groups there. People who would like to do it, but they can't do it. They've tried, as you were saying, my mind is so busy, they call it a monkey mind. It's just bouncing all over the place. Mm-hmm. Well, in Transcendental meditation, you don't have to use any concentration or control of the mind at all. We don't see the mind as a monkey. The insight is, given the opportunity, the mind will always be drawn to something more satisfying. So if you're in your den during lockdown, you're in a room in coronavirus, and you're doing some mindless work, and in the other room, some of the most exquisite music you've ever heard in your life comes on, where's your attention go? Just like that. So the mind is drawn to something more satisfying. Inside, hypothetically, you don't have to believe it, there's a nice place in there, quiet and peaceful, wide awake, we're aware of everything. It's not a trance. And in TM, we learn how to give the attention of the mind an inward direction. You get a sound, a meaningless sound you're given just from thousands of years ago, and you're taught how to use it. And it's like a catalyst. Like that. This is not an acquired skill, Richard. This is like, you can do it takes about an hour over 4 days to learn. And the last thing is, there's 1,440 minutes in a day. If we don't have 20 or 30 minutes to set aside for some serious, for some serious brain health, I think we may need to reprioritize our day, particularly if we know it can calm the amygdala, wake up the genius lounge and the default mode network. It's a matter of priorities.
Yep. Great analogy there. Like how many, 20 minutes? Oh, 20 minutes. Oh, I don't have that time. My patients say that to me a lot about exercise. Oh, I don't have 30 minutes 3 times. Are you kidding me? Come on. There's exactly. You have to put everything into perspective.
You sleep better anyway. You wake up feeling fresher anyway. So
yeah. And I don't know if I read a study on this or I've heard you talk, but I feel like the difference between 20 minutes once a day and then 20 minutes twice a day, I feel like there's a there's like a biological synergy there where twice a day is, I guess, recommended, or I don't know if there's evidence behind that, but how would you characterize that?
Well, I mean, traditionally meditation was done, at least transcendental meditation was done twice a day. Once in the morning as a preparation for the day, so you wake up and you're a little groggy and, you know, whatever, and delta brainwaves, and you sit and meditate, and then your body settles down and your brain reboots itself. And then what you find is it's not just relaxing, Richard, it's very energizing. People find it very energizing, and not a manic energizing, but a sustained. So now you go through the day, clear focus, more resilient, and then at the end of the day, tired, you do it for, you know, a few minutes, 15, 20 minutes, and then it washes off the stress, and now you're at home, and you're actually at home with your family. You're actually present. And then you sleep better at night. And there's, you know, go to tm.org, you can see the citations for the research. I'm not just like making stuff up here. But a lot of people can't find the second one. And I said, you know, do what you can. It's a tool. Take the tool and work it into your life as best you can. But we need tools in the toolbox. And one other thing, if people say to me, well, I do mindfulness, so I don't need to do this, or I do vipassana, and I said, it's not that way. It's not either or. It's evidence-based tools in the toolbox. This discussion was not what's better. Different mechanics, different outcomes, and they work together in a wonderfully synergistic way.
And so I would have never called myself a skeptic. I wouldn't use that word. I guess I would say I was uninformed for a long period of time. And, you know, for the last few years, just a quick story, but in our Alzheimer's prevention clinic, we track a lot of stuff. We track cognitive function on computers. We track, you know, blood stuff, cholesterol and metabolism. We track all sorts of different things. And one of the things we track, I'm wearing it right now, is sleep and exercise patterns. It's a little biometric device. It tells me my resting heart rate, my HRV, heart rate variability, tells me how much deep sleep I'm getting, REM sleep. Now, these are not perfect measures. No wearable is perfect. But we've actually done research and, again, published studies on using these wearables in different journals. And the thing, like, I guess, I wasn't skeptical, but the thing that where my brain or my something in me said, wait a minute, I can see, like literally you track when you meditate, so you can see on the person's, I would do a share screen now, but you see when you meditate, and then you look at heart rate variability, which is a physiologic measure of, are you more sympathetically driven or parasympathetic, you know, the rest and digest. And when this guy, the first time ever, started meditating, I actually saw his heart rate variability go up, which means you're more parasympathetically driven. His sleep patterns got better. His initiation of sleep came down. You know, not taking melatonin, not taking benzos. He literally was falling asleep in 6 minutes versus, 12 or 15. And he was sleeping better. He had more deep sleep. His total sleep was about the same, but he had more deep sleep and more REM sleep. And that's when I said, wait a minute, these are physiologic measures. And, we track cortisol every 6 months, but we don't track it every day. This biological connection, mind-body connection is something that I just didn't really know about. And now I've seen it, for my own eyes.
There's this great book called The Body Keeps the Score, where we have traumatic experience or any experience, and there's no barrier we know between subjective and mind and body. It impacts the nervous system, it impacts the brain, impacts the hypothalamus and the hippocampus, and you can see it, particularly again with what's so simple and accessible about TM, for me at least, and the people I teach, is you don't have to believe in it, and within the first hour or two, they see these changes taking place in the brain. They see the reduction in high blood pressure. They see the reduction in cortisol levels. So it's an extraordinary time, and it's all moving in that direction anyway. We can remain skeptical on the side, but there's so much data, and the studies, even with TM, that's going on, these large-scale phase 3 clinical trials with 8 VA hospitals. 10 years ago, that never would have happened. The money never would have come for that. Research, as you know, is very expensive. And now the research that we're going to do with Duke University and Thomas Jefferson University and possibly Mayo Clinic on physician burnout, and a study on nurses in TM in Sarasota Hospital. So I just make all these points that for those of you who are the three groups, those of you who are skeptic, great, be skeptical, but don't be a cynic. Cynic says, I'm not going to do anything. Skeptical says, I don't believe it until I see if it works. So that's what I am. I'm not a cynic, but I'm a skeptic. And those of you who have tried to meditate, tell others to meditate and tried yourself and can't do it, all meditations aren't the same. All medications don't work for everybody. All meditations don't work for everybody. So try something else. And for those of you who do meditate and prescribe it, keep going, because it's very healthy. It's very healthy.
So I would usually wrap up now, but I'm sorry. I'm going to take advantage of this time with you. So for medical students, we always find, actually me anyway, and I think other physicians too, it's very difficult to teach a student. You can teach a student facts, and you can teach a student, guidelines and evidence, but the application of that evidence is something that's harder to teach. And the hardest to teach a student in medicine is the gut impression. They're sick or not sick. If someone's sick, you do X. If someone's not sick, you kind of need to know. There's like a deep something inside of you that just knows when you need to act or react. And sometimes it's just nonverbal cues, looking at behaviors, all these different, intuition, we don't want to say that, is it having some psychic abilities, or what is intuition? And intuition is tricky, but teaching that to a medical student is some of the most challenging concepts. It's just like, I don't even know how to teach it. But the reason I bring this up is I guess I've spoken to at least one or two other people that have felt that through practicing TM, their intuition has been more matured or more in tune. How do you rationalize that? Is there any weight to that, or not so much?
Yeah. Calm mind. A calm mind. It's like a calm pool, If we're agitated, if I'm upset, if I'm distracted, if I had a fight with my kid and I this and that, and now I'm with a patient and I'm all disturbed, I got nothing. I got nothing. Or if I do, it's often a misreading. But if like Ray Dalio, the business person, talks about like a ninja. If I'm moving around and I've got this equanimity, this steady calm inside, alert, sharp, fast, strong, but inside, just steady, then I read situations better. Again, the frontal lobe online, and a calmed amygdala. It's all the difference in the world. And so I think that intuition or gut, if it's based on agitation and irritation, you're in bad shape. But if it's based on equanimity, that I should say, emphasize, it's there in this hypothesis with self-transcending. It's not something we have to believe in. It's not something we have to fabricate. It's like that ocean that's choppy on the surface and quiet at its depth. We're just accessing parts of who we are anyway. Right. But then you maintain it, again, through neuroplasticity, when the neurons that fire together during meditation wire together out of meditation. The experience is I carry that equanimity with me wherever I go. And I have to tell you, Richard, that the receptivity that we have for this Heal the Healers Now initiative, there's more interest from doctors and nurses and other frontline healthcare providers to the importance of meditating, and then once they learn it, at least getting in once a day, because they know what stress is doing to them. So don't let skepticism get in the way. That doesn't matter.
Yeah, that's great. Bob, thank you so much. This was a pleasure. I learned a lot, as always. This will probably be the first one that I actually watch from stem to stern every single minute. And this is by far, we've done 20 or so of these, by far the longest conversation we've had. So I appreciate it. Thanks for sticking with me. Thank you so much. But by the way, the next time I see you, I hope it's not on this silly computer screen. I hope it's at a Yankee game. I hope we get baseball going again.
Is that going to happen? Is that going to happen?
I don't know. I don't know. I think you know who to call to get some answers, but I haven't gotten any secret updates yet.
I grew up with a big Willie Mays fan, and I've just been, and he's a New Yorker guy. Yeah. So I miss baseball. But thank you for having me on. I really
absolutely. Thank you so much.